Thank you so much, Ruth, for the introduction. I am thrilled to be here with all of you this afternoon. Thanks so much for letting me into your lives for a little bit. I'm going to go through some slides and I'm going to ask you to hold your questions until the very end. I have to look at another screen with slides, so I can't see all of you. So if we can go through the presentation, then I'll open it up for questions. That will work best for me. So I'm going to start out here, and I always ask for someone to nod or tell me that, yes, they can see my slides. So great.
Yeah.
Got it. Thanks so much, Pat.
Thank you. Oh, Amy, let me just say one other thing. If people have questions and they're afraid they might forget them, which I probably would do, just put them in the chat and we'll go back to that afterwards. Okay, thank you.
Awesome. Okay, so we're going to be talking about Aging with Pride IDEA. IDEA stands for Innovations in Dementia Empowerment and Action. It is a study and a program, both being done at the University of Washington in the School of Social Work. Karen Fredrickson Goldson is one of the investigators, and then Linda Terry in the School of Nursing is the other investigator. And this study is funded by a grant from the National Institute on Aging, which is part of the National Institutes on Health. So Aging with Pride IDEA is the first federally funded research study examining ways to improve the health and quality of life for adults age 50 and older with memory problems and their caregivers in the LGBTQ plus community. And we use caregivers and care partners, it's the same, they mean the same. So if I say caregivers, we're also referring to care partners. So first, I'm going to tell you about why we're doing this important study, what has led us to come up with this, and then I'm going to tell you about the specifics of the study itself. Many people ask, why are we studying this specific community? There's a rapid growth of LGBTQ plus older adults with Alzheimer's disease and related dementias. LGBTQ older adults have higher rates of social isolation. They're less likely to be married or have children and more likely to live alone. They have higher rates of some chronic conditions and risk factors for dementia, including depression, cardiovascular disease, obesity, smoking, and social isolation. They're often medically underserved, stigmatized, and vulnerable, and there's a lack of efficacious research-based interventions for this group. We know a lot about LGBTQ individuals as they age from another longitudinal study being done by Karen Fredrickson Goldson. That study is the Aging with Pride National Health, Aging, and Sexuality Gender Study, or NHAS. And the results from that study have really informed and guided how and why we came up with the Aging with Pride IDEA study. The NHAS study is the first federally funded longitudinal national project examining the health and well-being of midlife and older LGBTQ adults. It's surveying over 2,400 LGBTQ adults between the ages of 50 and 100. It's been going on for 10 years and is still ongoing. And there's a good chance that at least one or two of you in this group are part of this study. LGBTQ older adults are a growing population. It's estimated that there's 2.7 million adults aged 50 and older that self-identify as LGBTQ in the US. 1.1 million are 65 and older. By the year 2060, the number of LGBTQ older adults will exceed 5 million. 10% of LGBTQ older adults report severe or extreme cognitive difficulties. 38% report moderate cognitive difficulties, and at least one area, and 77% report mild cognitive difficulties in at least one area. And when we talk about cognitive difficulties, we're talking about when a person has trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. There are health disparities among LGBTQ older adults. Lesbian, gay, and bisexual older adults have higher rates of disability and mental distress than heterosexual older adults. Lesbian and bisexual women have higher rates of cardiovascular disease and obesity than heterosexual older women. And gay and bisexual older men are more likely to experience poor physical health and to live alone than heterosexual older men. And all of these, remember, are risk factors for developing memory problems and cognition problems. This article on the right is one of the many, many articles that have come out of the NHAS study highlighting health disparities among lesbian, gay, bisexual older adults. It's come out of Karen Ferguson Goldson's research team. And if you Google her, you'll find she's done much, much work in this area. Other NHAS study findings: 13% of LGBTQ older adults report they have been denied health care or received inferior care. More than 20% do not disclose their sexual or gender identity to their physicians. Almost 2/3 have been victimized 3 or more times. 59% report they lack companionship. 53% feel isolated from others, and 53% feel left out. LGBTQ adults as caregivers, they become caregivers at a higher rate than the general population. 35% of caregivers in the LGBTQ community are providing care to a partner or spouse, 32% to a friend, 16% to a parent, 7% to another relative. Caregivers in the LGBTQ population are more likely than non-caregivers in that same population to report a disability, depression, victimization, and verbal and physical abuse. Who are these caregivers? Many LGBTQ older adults may not have a relationship with their legal or biological families and are instead supported by their families of choice. They're twice as likely to age without a spouse or partner and 3 or 4 times less likely to have children. About 2/3 of dementia caregivers in the US are women, but in the LGBTQ communities, both men and women have a high likelihood of caregiving. And LGBTQ caregivers often have limited legal power and can be excluded from decisions regarding where the person they care for will reside or what health care they will receive. And then there are different issues among LGBTQ older adults with dementia. Many have hidden their sexual or gender identities for much of their lives, and memory loss can introduce challenges surrounding how they manage that identity and the extent that they reveal or conceal their identity as their memory loss progresses. And I think this statement is just a perfect example of that. I am over 50, a trans health activist, afraid that my insistence on being who I am confuses people. I'm afraid of dementia and Alzheimer's. What if I go back to my 10 or 20-year-old self as a girl or a woman? So all of these factors together are what has led Karen Fredrickson Goldson to design and get funding for the IDEA study. Her statement is, studies show that LGBTQ older adults with memory loss and their care partners are understudied populations. And our project is designed to aid in the development of much needed interventions for vulnerable midlife and older adult populations. So let's talk about the IDEA study. It's based upon proven treatment. The foundation of the IDEA program is an evidence-based program called Reducing Disability in Alzheimer's Disease. That is a study that was done by Linda Terry at the University of Washington in the School of Nursing, and Linda Terry is one of the investigators on the IDEA study. It was done in the general population, folks with memory loss and their caregivers. The study had some pretty amazing results. The intervention that we provided to people in the study was shown to reduce institutionalization for the person with memory loss. That meaning they were able to stay in their home, in their community longer. It was shown to reduce stress for the person with memory loss and their caregiver. And it was shown to increase physical activity in both the person with memory loss and their caregiver. So we have taken this proven treatment program and added an enhanced component that addresses the unique risks, strengths, and resilience in the LGBTQ community. So prior to March of 2020, we were doing this program just on the West Coast and in people's homes. And when the COVID pandemic came along, we had to pivot and change our program such that it could be done virtually. We have been extremely successful in doing that. Everything we now do is virtually. We do not meet face-to-face with the participants in the program. All of the coaching sessions are done virtually using DoxyMe, a very easy to use telemedicine platform, even easier than Zoom, if you can imagine that. All session handouts and materials are sent by mail. If the person with memory loss and their caregiver do not live together, we still can include them in the program. And we wanted to not exclude people who didn't have a device, a tablet, an iPhone, a personal computer. We didn't want to exclude them from participating in the program. So if they need, we can provide a tablet with internet connectivity that they can use for the duration of the program. And then because we're doing everything virtually, IDEA is available in all 50 states. So the nuts and bolts of the program. There are 9 visits over 6 weeks with a trained coach who meets with the person with memory loss and the person who helps them. Coaches follow up with participants after the virtual coaching ends with 4 monthly phone calls. And there are 5 assessment interviews done by phone during a 1-year period. This is where we're getting the data that tells us whether this program is really effective in the LGBTQ community or not. And the pair receives $25 for each assessment they complete. So if they do all 5, that's $125. What do the coaches teach? There's problem solving. Coaching to identify consistent areas of tension and brainstorm ideas and approaches to improve behavior problems. There's coaching in strategies to address communication challenges related to memory loss and dementia. And there's a low-level exercise program that includes stretching, flexibility, balance, and endurance to strengthen the body, support independence, reduce injury, and improve mood. And I have to say, the low-level exercise program is very well accepted, and we get lots of great feedback from participants in the program about the exercise program. And then the 4th component, we address the distinct risks and strengths of the LGBTQ+ participants. Coaches also are available as a resource by phone or email. They cultivate ongoing resources and support for the caregiver and assist with connecting them to local community resources. And they provide a home safety assessment during the intervention. even though we're not in the home, we're doing things virtually, the participants can take whatever device they're using to connect with us. If it's a phone, if it's an iPad, if it's a MacBook, and they can show us different areas of their home. And then we can make recommendations as to how they can improve the safety in those specific areas. So who is eligible for the IDEA program? The person with memory loss and the person who helps them both participate in the program as a pair. Either the person with memory loss or their caregiver must be LGBTQ+. Oftentimes they both are, but only one of them needs to be eligible, and they do not need to live together. The person with memory loss must have a diagnosis of dementia or memory loss severe enough to reduce their ability to perform everyday activities. And that is all self-reported. We are not checking in with a healthcare provider to confirm a diagnosis. It's totally self-reported. And then the person with memory loss must be at least 50 years or older. Examples of pairs that we've had in the study are couples, partners, spouses, an adult child caring for an aging parent, a friend helping a friend who has memory loss, a caseworker assisting a client. All of these are okay as long as at least one in the pair is LGBTQ. Because it's a research study, we can't look at the data until we've collected all of it. So we don't know if it's really effective or not. We think it is, but we can't really look at the data and do the analysis until we're done completing it. But the participants are providing some really great feedback, and I'd like to read 3 comments to you. My partner and I just finished this research project. It is excellent for exercise and also problem solving with someone with dementia in our community. Her dementia has advanced pretty far. It was so good for her and myself, and I think for people in beginning stages too. Our coach was excellent, and we modified the exercises to meet our needs. We will continue using the problem-solving method we learned and got great ideas for support. Another comment, I feel strongly that Aging with Pride idea made such a difference. I was able to receive what I needed. You gave me new things to consider with support. And the last comment here, I love the exercises. Before this program, I couldn't put on my socks. Now I can. And I just was talking with a gentleman today who said his husband, prior to the program, couldn't buckle his own seat belt when they got in the car to go somewhere. His husband had to buckle it for him, but now the person with memory loss is able, because of these exercises, to buckle his own seat belt. Things that all of us take for granted, but are really remarkable to these participants who have been through the program. So the project partners, we are doing the study out of the University of Washington Schools of Social Work and Nursing. And of course, we're in Seattle, Washington. And we have community partners throughout the US. And like I said before, IDEA is offered in all 50 states. We have some great outreach resources. We have a wonderful website. It's ageidea.org. And I will send all of this information to Ruth so that she has it. She can send it on to all of you, just so you have it. If you want to share it, we would love for you to share this with those you know who might be interested. On our website, we have a great video. It's a 2-minute video that describes the program. We have flyers and postcards, as many of these as we can get out to people, put in people's hands or put in their email box. The more we can do that, the more people can be aware of this great opportunity. We're on social media. We have ready-made posts that we love for people to share. We have Facebook, Twitter, Instagram posts. I'm happy to send those on. So if anybody wants to share those, they can. And then contact information. And all of this is on our flyer in our materials. We have a study line devoted just to the Aging with Pride idea study. It's 1-888-655-6646. We have our own website, ageidea.org, our own email, ageidea@uw.edu. And you can certainly contact me if you have any questions, anything you want to talk about regarding the study. I'm Amy Cunningham. I'm amoore@uw.edu. And my number is 206-543-8445. Because we're a research study and we love facts and figures, and I threw a lot of those at you in the beginning, we have to reference everything we do. We have to back it up. So these are references, articles by Karen Fredrickson and Dr. Terry, with all of the information, all of the articles with the information that I presented earlier. All right, so I'm going to stop sharing. I'm going to come back to all of you and open it up for questions.